Hi, I'm Frank Capero, and I'm going to be going over pulmonary embolisms and the discharge plan. A pulmonary embolism is sudden blockage of a blood vessel in the lungs by an embolus. A PE can become life-threatening. Go to follow-up appointments and take blood thinners as directed. These are especially important if you were discharged home from the emergency department. Here you can see a embolus lodged in the left pulmonary artery. And discharge instructions are, first of all, you should call your local emergency if you feel lightheaded, short of breath, and have chest pain, or if you cough up blood. Call your doctor if your arm or legs feel warm, tender, and painful, or if they look swollen or red. Medications will be blood thinners that will help prevent clots. One of those will be warfarin. You should watch for bleeding and bruising while you take the blood thinners because it'll thin out your blood and it'll make bruising very easily. Such things as use a soft washcloth on your skin and soft toothbrush to your teeth. And this will keep your skin and gums from bleeding. You should tell your dentist that you're on any anticoagulants. Now wear a bracelet or necklace that says you take this medication. Do not start or stop any medications unless your healthcare provider tells you to. Many indications cannot be used with blood thinners. Tell your healthcare provider right away if you forget to take the medication or if you take too much. Warfarin is a blood thinner that you may need to take. The following are things you should do to be aware of if you take warfarin. Foods and medicines that can affect the amount of warfarin in your blood, such as vitamin K. It works best. Vitamin K is found in Griffey, leans, and certain other foods. You will need to see your provider for follow-ups when you're on warfarin. You'll need regular blood tests. And take your medication as directed. To prevent another PE, you should change your positions around often. Stretch, move around, walk around, exercise to help increase your blood flow. Maintain a healthy weight. Do not smoke, and ask about birth control if you're a woman who takes the pill. You should always make an appointment with your doctor or specialist as directed. You should do this so they can scan for clots and to see how long the clotting takes. Your specialist and you will need to know this information. Some blood tests are deminor, and it'll help diagnose or rule out the presence of a pulmonary embolism. If you are diagnosed with a pulmonary embolism, you may need a troponin test to evaluate if any injury to your heart has occurred. Like troponin blood tests, your doctor may order a P&B blood test if you've been diagnosed with a pulmonary embolism. This test is normally ordered to evaluate the seriousness of the heart attack. BNP are related compounds are released in the bloodstream when the heart is working too hard to pump blood. This can happen in pulmonary embolism due to the blockage of the blood vessel.